And now I would like to move from this bird perspective to Lithuanian case again. And I will talk about COVID-19 management strategy in Lithuania. Looking forward for colleague to turn it on. So we have two names for the strategy. One is official, bureaucratic way to say it's COVID-19 management strategy. On the other hand, we say it's new reality strategy, meaning the fact that it's quite a PR term. But on the other hand, it's quite easy for general public to understand and to put an emphasis that we do not have exit strategy, but we are asking people to live with a new reality strategy, which I'm going to present quite briefly. There are 4 goals in our strategy, and all of them are related with protection and preparedness. First of all, of course, it's related to health issues, and we are willing to protect lives and health of our people and protect our health system. On the other hand, we also have to be quite open as a country, not to let our economy to go down, and on the other hand, to keep our international connections that we are having and we would love to continue. And of course, we are looking forward for the next outbreak that may come quite soon. And our strategy's goal is to prepare for that wave if it's come. I will not speak very detailed about scientific approach which brought us to the strategy. I will just mention briefly that there is nothing very unique in our strategy looking from scientific approach. We just made a mix of 5 different approaches towards COVID-19. And I just would like to put an emphasis on cocoon immunization. We are not sure, none of us in the world is sure that immunization happens and that immunization is like kind of medicine for COVID-19. This is why it's in italic. But then we have some proven data that immunization really works, so we will definitely will apply it to our strategy, as the strategy document is ready to be changed anytime that any circumstances will be changed. There are 5 key principles in our strategy. I will talk about protection of high-risk groups and proactive identification and localization of new cases later on. But I would like to emphasize that, as the minister said, our society, our citizens were very responsible and taking care of each other. So we are planning to continue transparent and open communication with the public. And at the same time, we are ready to fight fake news, which became quite a problem in COVID-19. And it showed how small the world became regarding this issue. And one more important principle is evidence and fact-based decision-making. We try to centralize all direct and indirect data related to that, but this centralization doesn't mean that all decisions were taken in central government building, no way. It was very deep and good, fruitful cooperation with municipalities, with health institutions, and all those facts were really shared between us together. And every decision taken was really taken really carefully and looking at fact-based information. And finally, international cooperation. This COVID was quite a challenge for all international community. We should admit that. But we think that in the near future, if a second wave, third wave comes, so we should be more open and we should cooperate more between our countries, as this international cooperation brings really good results when we apply it. So, as I promised you, briefly about protection of high-risk groups. In fact, probably all of you know this saying of high-risk, low-risk groups. But I would like to emphasize that we decided to have classification of 3 risk groups. And it depends on personal risk of a human being and social risk. That means the darker color is, so that means that the higher risk a person is approaching. So in fact, this high-risk group is pretty easy and it's nothing unique, so it depends on person's age and on person's health condition. But it's interesting to see to medium risk group, which means that people who are in really good health condition, who are young, but they have many interactions with high risk group, they are put in our strategy in a medium risk group. That means, for example, if you are a young student, healthy, young student, active one, living there with your grandparents, that means that you are in medium risk group, as you are exposing yourself to many contacts and bringing possibly the virus back home to your grandparents' place. So this is the thing which is quite interesting and worth to be mentioned, I think. There are 4 priorities in our strategy, and of course it's virus management control, it's ensuring preparedness of our health system, and as we were discussing, psychological and physical health of a society is crucial as well. And we apply quarantine conditions while considering the epidemiological situation in the country, and colleagues will go a bit deeper into that. And of course, economic, social life, cultural life is a very, very big priority in our country. So I will focus only on 2 essential things here, and talking about proactive control. So as it was mentioned by the Minister and Mr. Guanais, we really focus on proactive testing. And first of all, we started with symptomatic cases, then we went to hospitals and other health institutions and senior care centers and other possible institutions where higher risk group people live. And then we moved to all other organizations where there's a big concentration of people, and we try to catch corona as soon as it is possible, and my colleagues will go deeper into that. How did we implement that in practice? This is quite a nice hymn. Part of it is in Lithuanian, but we don't want to go into details as it's related to strategy. But this is just an example how we try to control our hospital capacity and load management. We tried to do everything to avoid all those worst cases that other countries experienced. So we decided that our health system is consisted of 3 elements now. So it used to be emergency and planned healthcare system. Now we add COVID-19 here. So every organization in healthcare system has to have some kind of reserve, and we really try to keep the capacity and load management in an optimal way to plan COVID-19 patients to be coming to those institutions. And of course, relaxing on the restricting quarantine was done accordingly to all that information. And last but not the least, economy. All we did was not very unique, to be honest. We tried to release economy step by step. And after one stage release, we checked how the situation, how virus is developing, what is going on with the virus in society. And then we had data in about 10 days or 14 days that the situation is quite stable, and we're quite satisfied with it. So then we moved to the next stage of quarantine release. And in fact, we started release 3 or 4 weeks just after quarantine started, as we didn't want to kill our economy, to be very honest, as that means that the country could have really deep recession if we continue with quarantine for too long. So, finishing my presentation, I would like to emphasize that we are ready to change our strategy if vaccine is developed, if drugs is development, and of course if we have more information regarding immunization. And we say that there is no exit strategy, and we say it's the new reality, and that every person in Lithuania should adapt to this new reality. And we are very thankful for our members of our society who do that and who react really positively.